Health officials in the Democratic Republic of Congo say a new outbreak of the Ebola virus in a northern region has pushed the death toll in that country to 31. The figure is small in comparison with Liberia, where the death toll is at least 624. The humanitarian group Doctors Without Borders says Liberia's capital, Monrovia, has been hardest hit, and medical workers can no longer cope with the growing number of patients.
Ebola treatment centers are reduced to places where people go to die alone, where little more than palliative care is offered. It is impossible to keep up with the sheer number of infected people pouring in our facilities. In Sierra Leone, infectious bodies are rotting in the streets. Rather than building a new Ebola care center in Liberia, we are forced to build crematoria.
The head of the U.S. Centers for Disease Control, Tom Frieden, confirmed Tuesday that West Africa is in a desperate situation, but that there is still hope that the outbreak can be reined in. He spoke to reporters after returning from Liberia, Guinea, and Sierra Leone, where he met with Ebola responders.
But the window of opportunity really is closing. I could not possibly overstate the need for an urgent response to get more patients into care, more work getting done in the communities, safer burials. All of these things will begin to get this outbreak under control.
Meanwhile, suspected Ebola patients have appeared as far from Africa as the United States, Ireland, and Sweden. Experts say preparing for Ebola before it arrives is more helpful than trying to close the borders. Health authorities in Hong Kong have set up drills for early detection of the virus.
Our purpose of drills today is to ensure that the systems do have a mechanism to early detect the suspected cases and then send to here for isolations and testing for whether this is a Ebola cases or other diagnosis.
A new experimental drug called ZMapp has shown some good results. 2 Ebola patients treated with the drug were allowed to leave a treatment center in Liberia Saturday after testing negative for the disease. And 2 American health workers who contracted Ebola in Liberia recovered after being treated with ZMapp. Zlatica Hoke, VOA News, Washington.